Introduction to Pharmacology. Dr. Cho is introducing a new lecture for the Fundamentals course. He begins by explaining that pharmacology is the study of drugs, and that a drug is something that causes a change in the body. He further explains that if what we swallow is not active, nothing will happen. This is known as a prodrug. The selectivity of a drug will determine how many other things it affects. Dr. Cho asks how many of us, when taking a headache medication, thought that it might kill us? He emphasizes that we want drugs to be safe, and there are a couple of measures of safety: therapeutic range and therapeutic index. When administering drugs, we must consider several things, including how certain drugs, foods, and herbal supplements can interact with other medications. These interactions can make a drug less effective, more effective, or even toxic. Therefore, it is essential to be aware of these interactions. Medication errors in drug administration. 1. The number one kind of medical error is medication error in the hospital. 2. The nurse is supposed to administer medication orally, but in some cases might give it intravenously instead, resulting in errors. 3. The more politically correct term for this type of error is patient adherence. Drug administration process. The first step in getting a drug to work is to get it into the body. The route of administration affects drug absorption. Once in the body, the drug is distributed throughout the body via the bloodstream. Metabolism then occurs, which is the process of changing the drug. Some medications have dual effects, acting as both an agonist and antagonist. An agonist medication acts like a receptor, and a drug that blocks a receptor's action is called an antagonist. Understanding placebo and nocebo effect. The placebo effect occurs when a person experiences a positive effect from a drug, even if the drug does not have any actual therapeutic properties. This effect is largely due to the patient's expectation that the treatment will work. On average, about 20% of patients can experience this effect. On the other hand, the nocebo effect happens when a person expects something bad to happen and it occurs. Physiological variables. Physiological variables refer to how the patient's body works. Factors such as body fat percentage can determine a patient's reaction to a drug. A person who has more body fat may react differently to someone with less body fat. Disease characteristics. The severity of the disease and how it manifests can affect how a drug works. Genetic variables. Genetic variables can also influence how a drug works in a patient's body. Nursing responsibilities. In nursing, one needs to understand the different properties and effects of various drugs. A nurse needs to be both the pitcher and the catcher when it comes to administering medication. Nursing school teaches about 300 different drugs, but most units will have no more than 50 drugs that nurses commonly use. Planning is important when it comes to medication administration. It involves setting goals and figuring out how to achieve them. Implementation is the actual process of carrying out the plan. When it comes to nursing school, it's important to know the normal dosing ranges for some drugs, although not all can be memorized as there are so many. However, you'll definitely need to know the ones that are given regularly and appropriate safety measures. The right evaluation includes a time component, and nursing responsibilities involve evaluating and promoting the therapeutic effect of the drug. If the drug lowers blood sugar, for example, promoting its effect could involve encouraging the patient to eat less and exercise more to potentially make the drug more effective. The right assessment should be done before giving the drug, and evaluation should happen after giving the drug to know if it worked well. Minimizing adverse effects and interactions. There are several measures that can be taken to reduce the risk of adverse effects and interactions when taking medications. One simple step is to avoid taking certain medications together if they have adverse interactions, ensuring that they are taken at least 2 hours apart. Another approach is for pharmacists and physicians to work together to assess the necessity of prescribed medications for their patients. The role of pain medication in the opioid crisis. The overuse of pain medication has been identified as a contributing factor to the opioid crisis. However, it is important to ensure that patients with pain are adequately treated. Nurses can play a role in educating patients about the appropriate use of pain medication and addressing any concerns they may have. Regulations and the FDA. Before 1906, there were no regulations on the labeling or sale of medications in the United States. The Pure Food and Drug Act of 1906 required drugs to be accurately labeled. In 1938, the Federal Food, Drug, and Cosmetic Act was passed, which created the FDA and established regulations for drug safety and efficacy. The importance of FDA testing in children. The FDA can now require testing in children, as testing was not previously conducted in children due to ethical reasons. Drug companies can provide physicians with articles of off-label use if the drug has been approved by the FDA for a specific purpose and has been shown to be effective for that purpose. Unfortunately, The Controlled Substances Act of 1960 to 1970 has contributed to the current opioid crisis by cracking down on certain medications. Post-marketing surveillance is conducted during Phase 3 of drug development to test for any issues that may arise as millions of people take the drug. However, women and children are often excluded from this process. Drug names. Most drugs have several names. First, there is the chemical name, which is N-acetyl para-aminophenyl aminophenol in this example. Then, we have the generic name, which is acetaminophen. Sometimes, there's a different international name, in this case, paracetamol. Finally, there is the trade name, which is also known as the brand name. Sometimes there will be multiple brand names for the same drug, so be aware of that. Schedules of drugs. The 1970 Drug Control Act created what are called 5 schedules and empowered the FDA to choose which schedule different drugs fall into. Schedule 5 is the least dangerous. An example of a Schedule 5 drug is loperamide, which is an antidiarrheal. Then we have less dangerous and addictive drugs like Ambien or Xanax, which are classified as Schedule 3 or 4. Schedule 3, 4, and 5 can be called in by a provider, which means they are available with a prescription. Schedule 2 drugs are very dangerous, but the FDA thinks that they have legitimate uses that make sense. Pharmacokinetics. Absorption is the movement of the drug into the body. Here are some factors that affect absorption. 1. How quickly the drug dissolves. The more quickly it dissolves, the faster it is absorbed.